Hello, I'm Meg Milligan, and I'm honored to be with you at this year's International Conference on Interdisciplinary Social Sciences. I'd prefer to be with you in Barcelona, but this virtual presentation will have to suffice. The title of this presentation is the Health and Behaviour Survey, UK-US Comparisons. This is my co-presenter in absentia, Hall Beck, who prefers to be called Skip. He is currently a professor of psychology at Appalachian State University. This shows a list of some of the highlights from his illustrious history. I have a BA from the American University of Beirut and a PhD from Auburn University in Alabama, USA. I have a range of research interests. I am currently an assistant professor of psychology at Troy University. Although this presentation is brief, our goal is to publish a more comprehensive paper, cognizant that a goal is a dream with a timeline. Health-promoting behavior in general, which is the general topic of this presentation, refers to what a person does to maintain or improve wellness. And many lifestyle behaviors appear to influence morbidity and mortality risks. The Health and Behaviour Survey, which I'll refer to as the HBS, was developed as an assessment tool. The HBS measures self-reported health behavior, knowledge, and attitudes. We will focus on the behavioral aspects. Here's a list of some of the behaviors that are assessed, and you can see they're quite comprehensive, though certainly not exhaustive. In addition to basic demographic information such as age and sex, respondents are asked to provide other information such as height, weight, parental status, self-perception of weight, that is from very overweight to very underweight, and persistent health problems. The HBS was used in two very large international cross-sectional surveys of university students. The European Health and Behaviour Survey, EHBS, included over 16,000 students. It was conducted in 1989 to 92 across 21 European countries. And the International Health and Behaviour Survey, the IHBS, which collected data from over 17,000 university students across 24 countries in 1999 to 2001. Data analysis and publication continue. And this presentation is an addition to that body of work. This study I'll be talking about compares a subset of the European Health and Behaviour Survey data from 419 University of London, UK students with data from 393 Auburn University, US students of comparable ages, that is 18 to 30 years of age. There are some similarities between England and the US in the 1990s, including cultural, political organization, history, and both are based on Western market economies. In using college student research participants, this controls for socioeconomic status, which is a long recognized influence on health. Both samples from UK and US were from well-established traditional four-year brick-and-mortar universities that conferred undergraduate to doctoral level degrees. The results of this investigation obviously can't be covered in a 15-minute presentation. Therefore, for this year's conference, we decided to focus on three behaviors that are empirically associated with health and illness, namely salt, fruit, and red meat consumption. And besides that, it's fun to talk about food. There are a variety of reputable information sources, and I'm listing a couple of major informational sources here. the Healthy People 2020 initiative, the Centers for Disease Control, the World Health Organization, and the United Kingdom's Department of Health. These are a few of the well-known reputable sources of health information, and I have links here for anyone who's interested in getting more information on a very diverse variety of health-related topics. Generally accepted dietary recommendations in respect to the 3 behaviors we selected are to increase the number of fruit servings per day, limit sodium, salt intake to less than 1,500 to 24 milligrams a day. That's 2,400 milligrams, a teaspoon, so less than a teaspoon a day. And the amount recommended varies by information source and by person characteristics such as age and ongoing health conditions. And it is recommended to eliminate or eat red meat sparingly. Some of the empirically supported impacts on health include the following: that a high salt intake is associated with hypertension, gastric cancer, obesity, kidney stones, osteoporosis, among others. Red meat consumption is well known as a risk factor for developing cardiovascular disease. So little to no red meat seems to be the current guideline, although research is not entirely conclusive. Not eating enough fruit creates a higher likelihood of developing cardiovascular disease and some cancers, such as gastrointestinal. We are advised to consume at least 4 to 5 portions of fruit and vegetables a day, portion size being approximately the size of your fist. So what did we find in our studies? One-way ANOVAs indicated statistically significant differences between the UK and US groups on each variable that we looked at. On average, this means that the UK group reported healthier behavior compared to the US group. A gender effect on health behavior is well established in favor of women, and our study mirrors this gender effect. I have tables that show you U.S. salt, meat, and fruit intake behavior, and then again for the UK sample to show you the gender differences. What we found is both the US and UK results showed statistically significant differences on salt and red meat. Here is salt. Here is red meat, and you can see there's a tremendous difference between men and women on their consumption of meat. But both the UK and US showed this effect such that women reported healthier behavior. But there was no significant gender differences on fruit intake for either the UK or US samples. This is the result of adding salt to meals in the UK group. And as you can see throughout, lower numbers reflect healthier behavior. So it is best to state never adding salt to meals. We see a larger percentage, certainly a larger percentage than we'd like, usually add salt to meals, and this is true in both samples. Red meat consumption, here again, we see in the UK 60% of men and 38% of women eat meat daily. There's a cultural influence here as well as significant gender difference. Okay, overall conclusions. A comparison of the UK and US samples reveals significant differences between these groups, as well as gender effects. Overall, the UK sample reported healthier behavior, healthier lifestyles on the targeted behaviors compared to the US group. In addition, there were noteworthy gender differences, with women overall reporting more health-promoting behaviors. Our future plans regarding this research, or what's in the offing: a more comprehensive analysis of our existing data, so we have a lot of work to do in that area, and another study in the not-too-distant future to look at an update. Thank you for your time and interest. I appreciate it, and enjoy a tremendous conference. Thank you very much.